We had the session yesterday on pandemic preparedness, and of course that is my job, that is my work as the WHO Special Envoy for the Access to COVID Tools Accelerator, and also my job with the Africa Countermeasures and Readiness Alliance. So the One Health approach is critical. The One Health approach, incorporation of climate into this whole conversation, which came at the last working group meeting, but is a very welcome addition, because as we see, the COP28 this year is going to be in UAE, and there will be the very first day on climate and health. We're all beginning to experience these extreme weather events. We're beginning to, the temperature in parts of India and parts of other parts of the world has been 47 degrees really early on in the year. We're seeing how that links to health. We're seeing how that links to malaria, how that links to the spread of disease, dengue. We're seeing how the floods and there were floods recently in Pakistan, there were floods in Africa. There's outbreaks of cholera everywhere. All of these things are interlinked. There is no isolation in all of this. So if we're going to be prepared as a global community, to fail to prepare is to prepare to fail. With COVID, we were not prepared. We had not, as a global community, internalized the fact that this threat was real and it was very present. But I think we're now internalizing that the climate threat is real. The nexus between climate and health is a critical nexus. It's a critical nexus for us, those of us who are working in the areas of preparedness and preventing. Let's not just talk about preparedness. How much can we prevent the next threat? And so, as we talk about platforms, as we talk about One Health, as we talk about preparedness, it is critical that the climate area comes to the fore, and it's critical that the advocacy that has been done by the G20 presidency in that regard is admirable.